distraction.
Great. Okay, so we're going to do an example of maxilla distraction on Jenny here. It's important to note that in most cases, before we do maxilla distraction, we'd be managing upper thoracic, cervical, and upper cervical spine. Cranial bone suture movement is controversial in physical therapy, but it could be something that would need to be managed, the occipital bone, the temporal bone, to get things moving. But we're going to do treatment on the one bone that we do know moves, which is the maxilla. Okay, Jenny. And we're going to be looking at some of the soft tissues around her maxilla as well, if she has some tension on it. And Will, if you could come in before we start the treatment, we want to take a look. And actually, before Will does a video of it, Jenny, just feel around the roof of your mouth with your tongue so you can get an idea of the amount of space that's in there and what it feels like. Okay, you got that? Okay, just tilt your head back so that Will can come in and take a look at the maxilla. Beautiful. We getting a good view of that? Okay. Mildly narrow. We're going to see if we can't show some changes in that with a quick treatment here. Okay, go ahead and rest, Jenny. And we're just going to come in. Go ahead, hand up here, just in case you're uncomfortable. So I feel a lot of restriction just right off the bat to her left side. And I'm just going to come in to the side here and treat her pterygoid to start for a second. I'd relax your jaw, Jenny, and just let that go. And if you could just do little chin tucks. Oh, that's a big chin tuck. That's
Sorry.
No, that's good. That's good. So just giving her quick mobility. Not going to do a full treatment, but just quick mobility on the pterygoid on this side. And we'll come back to the maxilla. And I'm going to distract laterally and also for her a little anteriorly. Jenny, you doing okay? Mm-hmm. And we're seeing that left side loosen up for a little bit better end feel. Doing great, Jenny. Just gonna drop back. And anteriorly, she's got pretty good motion, so I'm focusing on the lateral distraction, particularly on the left side. Excellent. In Jenny's case, I'm actually just going to go check the lower wings of her sphenoid as well, because I think she might have a drop on the left side here. So we're going to come in here, and we're going to go back past the hard palate, over her soft palate. And we're looking for the wing of her sphenoid. Okay, Jenny, just a couple little chin tucks on that there as well. Great. And relax. We're going to come back to the maxilla one more time. Excellent. Feeling for a springier end feel on the maxilla, and that's great. Jenny, go ahead and feel with the roof of with your tongue, the roof of your mouth, and see if you can notice any more room in there. And let's do one more time, just tilt the head back, and we'll come in to see if we can't see any changes. And just in a quick 2-minute treatment, the expansion of the maxilla. Fantastic. Okay, that's great. Good. End video.